All right. Hello, everyone. Thank you for joining us for our Arts and Health webinar. Today, we're going to be speaking about strategies for innovative funding and partnerships in arts and health initiatives. And we've got a very full schedule for you today. We're looking forward to hearing from all of our panelists, and we also have a creative opener. But before we get started, we can go to that next screen there. My name is Nefeshi Israel. I'm the Director of Programs for CA for the Arts. And again, I'm excited to have each of you here for our second session of our 4-part webinar series on arts and health. Please introduce yourself in the chat. Please acknowledge the indigenous land where you reside. I actually am on the unceded ancestral land of the Yokuts tribe here in the Central Valley in the San Joaquin Valley. I live in Madera, right outside of Fresno. If you'd like, please share a link for folks to connect with you and learn more about your work. And this event is going to be recorded, and the recording slides and all resources will be shared to you as registrants. You can go to the next slide there. Questions are welcome at all times. There is a Q&A feature. It's hard for panelists to be able to answer questions in the chat directly. And so if you use the Q&A feature, that will also allow everyone to see your questions and for panelists to answer your questions directly. We ask that you avoid buzzwords and explain references and acronyms so that everyone has an understanding of what we're speaking about. And that's in the chat also. So if you're putting an acronym, just go ahead and explain it out, spell it out for everyone. Please be respectful of your fellow advocates here today, honor perspectives, and give others time to speak. And if you're not comfortable speaking up, which, we're going to have the chat, just use the chat where we may not have time for everyone to speak. So we really utilize the Q&A feature. We've got quite a few people that have registered for these sessions. So the Q&A feature is going to be our friend. All right, and you can go to that next slide there. This just gives us a little bit of information about our organizations. We have 2 sister organizations. CA for the Arts champions arts and culture is essential to vibrant California communities through statewide programming, services, and advocacy networks that foster public awareness and generate resources to cultivate an equitable and thriving arts and cultural workforce sector and creative industries. We also have our lobbying partner organization, or CA Arts Advocates, and that is a comprehensive lobbying organization established in 1996. And we are sister organizations, so you'll see both a lot of times hand in hand. All right, one of our key initiatives is our Arts and Health initiative. So again, thank you for joining us today and for these upcoming sessions. Hopefully you can join us. As we recognize the arts as a powerful tool to enhance the health and well-being of our communities. I would also like to take a moment to acknowledge the many artists, culture bearers, and creative workers who have been serving as health and wellness practitioners for generations. We understand that while the conversations around arts and health may seem new, these practices have been deeply rooted in diverse communities worldwide. Lastly, I would like to extend a special thank you to our sponsor for this series and our Arts and Health initiative, the Music Man Foundation. Now I'm pleased to pass the spotlight to CA for the Arts and Health Special Consultant, Jennifer Kua.
Thank you, Nefesha, and welcome back to those of you who joined our first webinar, and welcome in to those of you joining the series today. I also go by Jen, and I'm currently working on projects focused on programming, research, and policy with groups such as the Center for Arts and Medicine and the Jamil Arts and Health Lab. I have my bachelor's in music and marketing at San Francisco State and my master's in public health from Cal State Northridge. So here at CA for the Arts, I'm working with a team to develop an arts and health initiative. And we've created this webinar series not only as a platform for practical conversations about the use of the arts in enhancing the health and well-being for everyone, but also as a significant step in our movement for prioritizing the implementation of arts prescribing programs and socializing arts and culture as a social determinant of health. On the screen here is the list of the entire webinar series. You can register for the other webinars on the website and watch the recordings on the YouTube channel playlist. So regardless of your experience or knowledge about arts and health, we hope that each of these webinars will provide you with a curiosity to learn more and the inspiration to brainstorm how you can take action as an individual or group to advocate for arts and health initiatives. So in the first webinar, we went over the health benefits of arts engagement, research on social prescribing, and the importance of mobilizing communities. Today's topic will be on strategies for innovative funding and partnership. We are thrilled and grateful to have three amazing leaders who are paving the way for arts on prescription and social prescribing programs in New Jersey, Massachusetts, and California. The speakers will share their expanding programs that harness the power of the arts to improve health outcomes. You will learn the diverse strategies they use to secure creative funding and form impactful relationships that are driving meaningful change. And in the spirit of creativity, each webinar will kick off with a creative moment, and today will be presented by Jazlynn Pastor with Movement. The speakers on panel today are Alyson Maier Lokuta, Michael J. Bobbitt, and Dr. Elizabeth Markle. You can read more about them on the webpage. And the format, how this will go is each speaker will present for about 15 minutes, and in the last 30 minutes will be dedicated to Q&A. As Nafesha said, for the audience, please go ahead and type in any questions during the presentation in the Q&A box, and our team will help to monitor and track that so it doesn't get lost and mixed in with the chat box messages. Then we will conclude with some announcements. So let's get started. For today's creative moment, I'd like to introduce Jazlynn Pastor, who is a cultural worker and teaching artist dedicated to serving the community through storytelling. She has spent the past decade learning Philippine dance in the Bay Area and sharing it with communities around the world like California, Hawaii, and Colombia. Jazlynn is currently pursuing a Master's of Education in Curriculum and Instruction to learn more on how to make dance and cultural arts more accessible in schools and the community. She continues to practice art as a connection through her LLC Pinaypages, which offers experiences for people to incorporate creativity and wellness into their everyday lives. So let's go ahead and welcome Jazlynn.
Hello, everyone, and thank you so much for having me. Thank you, Jen, for the introduction, and to California for the Arts for having me be here today. It is a big honor and a big win for cultural arts that I am here presenting an exercise that I have created, and thanks to my experiences from Philippine dance, creative movement, and breathwork. And so if you will join me, I'm going to bring more room into my space, into my box, and you're welcome to join me sitting or standing. For today, I will be sitting, and what we'll be doing is combining some movement, gentle movement, with some breathwork. And we'll start by warming up our hands. And we're going to open our hands to start feeling some energy, gathering energy into our body. Maybe your hands feel a little tingly, and that's okay. And we're going to start as if we're going to be opening in for a hug. This allows our hearts to open so that we can take in the information that's going to be shared today and meet someone new. And for our first movement, we're going to breathe in, raising our arms, letting air come into our lungs so we can take nice breaths in to wake up our body, our mind, and our hearts. And as we breathe out, we're just going to gently bring our arms to our sides. And so that'll be the movement we'll be doing today. I'll guide you through it 4 times, focusing in on breathing in, allowing oxygen into our lungs to wake us up because it's Wednesday. And as we breathe out, letting our arms fall towards our sides gently. And so if you're ready, we are going to welcome in energy one more time into our hands and into our bodies. Open our hands as we feel the energy and open our hearts. And for our first float, breathing in and breathing out. Again, together, breathing in and breathing out. Maybe there's a sound. Start 3rd time again, breathing in and breathing out. Noticing how your body's feeling, more relaxed, more awake. And if you need another one, we'll do this together at your own time. To breathe in and to breathe out. Taking a moment again to notice how our bodies are feeling. For me, I'm feeling more awake in my head, and I'm noticing I could use more energy. And so we'll bring it back here, warming up our hands. Maybe your body's feeling a little tense because you've been sitting for a while through the week, or sometimes our body just needs some extra love. And so as we open our hands this time, welcoming in either hover hugs or actual gentle hugs into our body that might need some tender love and care. And one more time, warming up our hands for our final float as we open our hearts again as we're about to receive a hug, welcoming in our speakers for today and our guests for today, and for you because you are here and you have arrived. Breathing in and breathing out. Thanks, everyone. I enjoy sharing this exercise to folks of all ages to, again, breathe in. I enjoy the power of 3. I'll do 3 floats, sometimes in my day, sometimes in my car, and especially for folks that need more energy or just a moment for grounding, this is very helpful. And so before we go, if you continue this exercise throughout the day, if you want some variations too that I find helpful are, so we have our floats. If you're trying to welcome in energy, I enjoy this movement where I will come in, close, and bring to center. You can try that with me 2 more times. We breathe in, close, back to center. And one more time, we breathe in, close, and back to center. And for the last one, in case you need some release, you'll go the opposite way, starting here, up and out. 2 more times. Here, up and out, and here, up and out. And that's it. You just learned some creative movement with breath work. I hope you all have a wonderful rest of the webinar. Thank you so much again. I am Jazlynn or Pinaypages. Enjoy the rest of your day. Hope to see you online.
Thank you, Jazlynn, for that. That was so amazing. It felt really good just to get a nice little stretch in. I was not able to do my stretching this morning, so that was excellent. Thank you so much. You all can connect with Jazlynn with the info provided on the screen and in the chat box. Thank you, Terry, for dropping that in the chat box. So please do follow up and stay connected with Jazlynn and the work that she is doing. Now I'd like to introduce our first speaker, Alyson Maier Lokuta, who is the Senior Director of Arts and Wellbeing at the New Jersey Performing Arts Center known as NJPAC or PAC, and founder of Arts in Health and Health Consulting. In her role at NJPAC, Ali leads innovative research, evaluation, and programming at the intersection of arts and health, serving communities in Newark and New Jersey. She is leading the first Arts on Prescription pilot in New Jersey in collaboration with Horizon Blue Cross Blue Shield of New Jersey and Rutgers University, Newark. Prior to this role, Ali was the inaugural Assistant Director of Arts in Medicine and Arts Program Manager for NYC Health and Hospitals, and has taught courses at University of South Dakota and University of Florida Center for Arts in Medicine, as well as developed curriculum in the Foundation of Arts and Healing. Thank you, Ali, for joining us today.
Thank you so much, and hello, everyone. As I said, my name is Alyson Maier Lokuta, and I'm here as Senior Director for NJPAC, the New Jersey Performing Arts Center located in Newark, New Jersey. At NJPAC, we really consider ourselves an anchor cultural institution, and by celebrating diversity, our mission is to be America's foremost urban presenter of arts and entertainment, an effective leader in arts education, a convener for civic engagement, and a catalyst for economic development. I came on board as a consultant first in 2021 and full-time in this role, which is a new role of Director of Arts and Wellbeing in 2022. So I just celebrated my 2nd year here at the Arts Center. And as an agricultural institution, we've kind of been able to really redefine and take a second look at what is the role of a performing arts center in our community. And in my role, I'm here to look at the intersection of our work as an art center and health and well-being. And so we have some kind of founding bold statements that we have kind of settled upon to ground some of our work, including performing art centers are community health centers, arts education is public health, taking part in the arts is a positive health behavior, and access to the arts is a social driver of health. And we know all of this through years of research now. I usually have an evidence-based slide following these statements, but I feel like this audience here is familiar with that, right? We know that the arts are good for our health, and what do we do about it? So taking all of the evidence and looking at NJPAC's role as an agricultural institution, the question when I came on board was, what are we really best suited to do? And we came up with 5 pillars of programs and initiatives for arts and well-being. So everything from a research lab to programs in hospitals, to the ArtsRx pilot that was just mentioned, to various events and programs that use the arts in intentional ways to deliver health and well-being, and filling a gap in the field for training and education. So I'll talk a little bit about each of these pillars. And then as our focus today is on funding, I'll talk a little bit about how this all came to be and our funding strategies here at the Art Center. So we'll start with the Arts and Health Research Lab. So the Research Lab goals are to measure impact through this kind of cross-disciplinary partnership. So we've created a partnership with Rutgers School of Public Health and Mason Gross School of the Arts and NJPAC as a community engaged arts partners. Our focus is on research, education, and community development. We've begun some mapping studies, an indicator study, and we're working right now on an NJPAC research and evaluation agenda, trying to answer those big questions like, what is the role of a performing arts center on community health and well-being? And then more specific questions about our particular programs, for example, like our Artist in Residence program or our Photo Voice program. What are the direct impacts of that on health and well-being? This came about through conversations between myself and the 2 deans of the School of Public Health and Mason Gross School of the Arts, and was really an enthusiastic partnership. And we look to our colleagues in similar research labs at the University of Florida, Center for Arts and Medicine, or the Arts and Mind Lab at Johns Hopkins or Jameel as our colleagues, and kind of looking to collaborate all the time with those other research institutions to advance research in arts and health. Our next pillar is arts and health care. So this is anything that has to do with arts that happen in healthcare spaces. One of our key supporters in this work is RWJ Barnabas Health System here in New Jersey, who's one of our endowing supporters. And so one lesson that I took from my role at Health and Hospitals is that, it's really difficult to try to go so broad with arts and medicine and arts and healthcare work. And so we were starting in our backyard here in Newark at Newark Beth Israel Medical Center, going really deep with a few key programs. So we have artists in residence at the bedside, working on the inpatient pediatric unit. We produce bi-monthly now. We just increased the frequency actually. So twice monthly concerts in the lobby with jazz, classical, cultural music, and Culture Connects, in which we program artists for staff cultural heritage event, which is really fun. So like you'd seen a picture there, we had our 90 Chen dance company come for Lunar New Year this past January. And this has been really a successful approach. So we're already looking at expanding the Artists in Residence program. We've had requests to, have the music series in the lobby weekly. We get requests for artists for cultural events all the time. And now, neighboring hospitals that are a part of the RWJB health system are requesting these same programs. So Cooperman Barnabas, for example, in Short Hills is really interested in starting their own Music in the Lobby series. So we're learning, if we can go deep in one program or in one hospital and create like a real culture change, then we can set an example for kind of replicable programs in other hospitals. One of the most talked about programs right now is our ArtsRx program. So in this program, we have free prescriptions or referrals to arts activities across Newark to enhance health, well-being, and social connection. Our premier partner in this is Horizon Blue Cross Blue Shield of New Jersey, and we launched this project with them in July of 2023. So we just celebrated our 1-year anniversary of this program. In January, we added on Rutgers University Newark, so their students are a part of this program. And now, actually, next month, thanks to an Our Town grant from the National Endowment for the Arts, we're adding our city's Department of Health as a referral source. So anyone is eligible, that sees these 3 referral sources, but we tell the people making the referrals that this opportunity is especially useful for those experiencing social isolation, loneliness, caregiving, anxiety, depression, or other behavioral mental health issues. We've created a coalition of arts organizations across the city to deliver these arts activities. And so people do come to shows at NJPAC, but they also go to Glassroots for glass blowing. They do soul line dancing at New Jersey Symphony. They do stage combat classes at Luna Stage, writing workshops at the library. They go to dance classes or ceramics classes at our School of the Arts, and different programs at the museum as well. So we're actively adding new arts partners, and now we get to add referral sources as well. We're measuring this program through a partnership with the University of Florida Center for Arts and Medicine's Epi Arts Lab that's looking at an implementation science study of social prescribing across the US. And in the new year, we'll launch our own research study of our program in partnership with our research lab, of course. And we'll be looking at social connection, self-efficacy, and loneliness as different markers for impact for the program. Our next program is health promotion, or our next pillar is health promotion, and these are any events and programs that address key health issues through arts, culture, and creativity. And so some kind of key markers of this are our wellness fair, where we bring both arts and health vendors into our lobby space and open it up to the public. So you can, as you're walking around the tables, you can get your blood pressure checked, you can get your glucose checked, and then you can create like a mandala. And then you can learn about breath and posture exercises, and then you can learn about PT. So really creating kind of an ecosystem that marries arts and health together. Ritual for Return is another great example of a program that's in the recruitment stage right now. We did a full year of it last year, and the next session is starting in September. It's a 12-week theater program for formerly incarcerated individuals that ritualizes the re-entry into their community, and really symbolizes a welcome back into their community. And we're a Lullaby Project partner site, which is a program out of Carnegie Hall in which we partner new and expecting parents, mothers, families with songwriters to write customized or personalized lullabies for their babies. The last piece of our programmatic pillar is training and education, and we really think about kind of building capacity for this type of work. We see, there are tons of teaching artists around. There's a lot of energy around arts and health, and there isn't a lot of really accessible and affordable education. And so we're building the Access platform in partnership with Rutgers Arts Online and the Pat Steinmetz Foundation to kind of create an accessible and affordable education platform. So these classes will be all online, asynchronous, about 15 hours of content per course. and you'll be able to kind of choose your own adventure through the courses, learning about arts and public health, learning about trauma-informed practice, learning about evidence-based practice, and then get more kind of subject-specific as we go. This platform we're planning to launch in the spring of 2025. So we're in the middle of kind of content development right now. It's really exciting. So I'll transition now to talking about funding, right? So how does all of this happen? Well, a big part of why this was able to be, why my position was able to be created was through an endowment created by RWJB Health System and Horizon Blue Cross Blue Shield of New Jersey. When I came on as a consultant, one of the big pitches was the strategic vision for arts and well-being at the New Jersey Performing Arts Center, and we were able to secure an endowment for this work. We also have a Women at NJPAC board who has been instrumental in being a founder supporter. And then you see we have a kind of varied support from different foundations and government and corporate sponsors, and individuals, which really mirrors kind of NJPAC's development overall. So NJPAC, our development team, raises over $13 million every year for the kind of social impact operations for the Art Center. You can go to the next slide. So you can see that we raise money from our board, from individuals, corporates, foundations. We have membership, and we have our government and then women at NJPAC as all different kind of pieces of the pie. Our social impact programs overall cost about $6 million to operate between arts education, community development, civic engagement, and arts and well-being. And so this development piece is a really important kind of component in how those programs are operated. So individual giving is kind of what it sounds like, our membership. So, membership to NJPAC starts at, I think, $50 a year. So those kind of small contributions, all the way to, folks giving millions of dollars to the Art Center over time. So these are personal philanthropy, and we have a team dedicated to individual giving. We also have corporate partners and sponsors. And I think this is a really interesting piece of how we raise money and how we are like maybe different from other art centers, where it's not just a logo, kind of slapped on the side of a building, but we really form true partnerships with our corporate partners and sponsors. And our partnership with Barnabas and Horizon is a really good example of this. Yes, they've given funds to endow the work, but they're really thought partners in how we execute the work together as well. And so we build those relationships over time. And then with foundations and government, it's kind of the last piece of the puzzle, always looking for different grant sources, looking for new funding sources, and how we kind of meet how our programs align with the objectives of those opportunities as well. So I'll stop there, and I'm excited for the Q&A later to answer any questions anyone has.
Thank you so much for your presentation, Ali. It's truly incredible to hear all the facets of what NJPAC is doing with partners and funders to provide art-based activities in various settings and populations. Thank you so much. So if you have any questions for Ali to address during the Q&A segment at the end of this webinar, please make sure that you're typing it into the chat, the Q&A box and not the chat box, so that they can actually, the panelists can see the questions and then perhaps type in the questions or the answers if they're able to answer just via typing instead of the verbal. So make sure that you are clicking on the bottom of your Zoom window, the Q&A button. If you don't see that, it might be under more. So if you see a more selection, click on more, and then the Q&A should be there. All right. So for our next speaker, I would like to introduce Michael J. Bobbitt, who is an distinguished theater artist and the executive director of Mass Cultural Council. As the highest ranking public official in Massachusetts state government focused on arts and culture, he has led the agency through several initiatives, including the development of its first racial equity plan, Deaf and Disability Equity and Access Plan, Native American and Indigenous Equity Plan, and the launch of the nation's first statewide social prescribing initiative. He recently received an honorary Doctor of Fine Arts from Dean College and is a proud alumnus of the University of Massachusetts Amherst. Thank you, Michael, for joining us today.
Thank you, Jen, for having me. Thank you, CA, for the arts. It's good to be in the room with so many innovators and leaders and talking about this beautiful intersection of arts and health. I'm excited to be here. We can go ahead to the next slide. This is a fun, gorgeous picture of the beauty of art. Next slide, please. So just so if you don't know, Mass Cultural Council is a state agency that supports the creative and cultural sector of Massachusetts. We do it through economic vitality advancement, through policy work, advocacy work, systems change, and really celebrating and preserving and inspiring creativity all across Massachusetts. Recently, our work has been pivoting a little bit more towards the policy and the advancement work, because I think that's where the sector needs more support. There isn't a lot of cultural policy that exists in our dockets across the country. So there's an endless bucket of possibilities. So we've been focusing on thinking about that. Next slide. You know, as Nefesha mentioned, art has been around healing people since the beginning of time, and we are just looking at some models to integrate it more into healthcare. And so a few programs I'm going to tell you about today. One is the Arts Prescription Program. You heard a version of it from Alyson. We have another layer of it that we've added to it. We have our Card to Culture program, which I'm super excited about, a universal participation initiative, and then this new thing that we're starting to push, which is an arts and culture benefit for employees. Next slide. So arts-based social prescribing. If you don't know, social prescribing has been around for about 30 years. I think it was first defined in the 1970s. And this is a model for delivering health and social interventions by enabling healthcare professionals to prescribe all kinds of community referrals to their patients. We focus specifically on the arts, but people have been prescribing food and parks and all kinds of things. We're focusing on the arts. We launched this program after we learned about some information from the UK and Canada, and we brought it over here to Massachusetts, and we beta tested it for a couple of years with about 30 healthcare providers and 12 arts organizations. We were able to write almost 2,000 prescriptions, and Mass Cultural Council funded the reimbursements for those prescriptions. We have decided to scale that and look for another more sustainable model beyond the philanthropic model. Next slide. So we have been partnering with this great organization called Art Pharmacy. It's a healthcare services business. You saw a photo of Chris Appleton on one of Alyson's slides, who I think is part of her advisory council. We really want to scale this program and launch it statewide, specifically using third-party payers to fund these arts prescriptions. So we were lucky enough to get one of our state's largest healthcare systems, Mass General Brigham, and their healthcare plan, United Healthcare Plan, to help us with this idea. So I want to tell you a little bit about the way it works. So we have over 400 arts organizations as part of the network, and they're all in Art Pharmacy's system. Healthcare providers at Mass General Brigham can prescribe 12 doses of arts and culture to their patients to support their mental health needs, their physical health needs, their social isolation needs. The patient will then get a call from a community referral person, a care navigator, I think is what Art Pharmacy is calling them. That person will have an intake meeting with the patient to find out what their medical needs are, what their demographics are, their ethnicity, and what kind of arts and culture they want to experience. On the back end, arts and culture organizations have gone through some safety training, some of the kind of trainings that are needed by third-party payers. They've uploaded their activities onto Art Pharmacy systems. And so when the care navigator comes back to the patient, they'll have a bunch of options for that patient to go to. The prescriptions often will always all include a companion ticket. If we're dealing with mental health and social isolation, we don't want to send people to arts organizations or arts activities without a person to go with them. And then when needed, it will also cover transportation, because we know that that can be a barrier for people. The patient picks the arts activity they want to, and then they get 4 visits to that arts activity. They can come back and change. If they try dance, they can go back and say, I want to try theater, or come back and say, I want to try pottery. At the end of the engagement, which is again 12 doses, they'll have another meeting with the Art Pharmacy Care Navigator to take some data and some information in that can then be reported back to the healthcare provider and also to the payer. And then we can report on the success of the program. And then Art Pharmacy pays the healthcare, the provider that pays the arts organization for the tickets that they have provided, or the experience that they've provided to the patient. I think the big difference in what Alyson described was that this is being funded by healthcare plans. It's not coming from philanthropy, though philanthropy can participate in this. We like the idea of third-party payers like insurance companies and managed care providers funding this. It is my belief that the issues we're talking about, mental health, social isolation, physical health, these are healthcare problems, and the arts should be paid for being medicine by healthcare. Healthcare should be paying for healthcare problems, and the arts can be a form of medicine, an intervention tool. So that's what we've designed. It's in its infancy. I think this thing can be a gateway for all kinds of prescriptions, food prescriptions being covered by healthcare, all kinds of prescriptions can be covered. So we're scaling this now. This will depend highly on the arts sector getting into rooms with healthcare and talking about this initiative. We also think it may be a more sustainable model if it's coming from healthcare and not from philanthropy. So that's the really cool kind of thing we have just initiated across the state. Next slide, please. We also have been working with a few other departments in the state, specifically Department of Transitional Assistance, the Massachusetts Health Connector, and then Women and Infants and Children Nutrition Program. So anyone that's on these state assistance programs gets a card. We have over 400 arts organizations offering discounts or free admission to a variety of arts events. And all the person on the card has to do is to show their card, and they get all of these discounts. Each arts organization can determine what kind of discount or freebie they want to offer. Some people have done free parking. Some people have done discounts on summer camps or classes or tuition. We've had more than 1 million admissions have been granted to low income and working families through this program. All of your states have some kind of state support program that probably has some card. And so these are often an easy way to engage the arts in that kind of work. Next slide. Universal Participation Initiative. Universal participation is a disability term that talks about how we can make all of our work more accessible to everyone. So we founded this initiative, which had a few parts to it. So it aims to activate the aspirations of the Americans with Disabilities Act to break down the barriers that prevent full civic participation in cultural sector. So there were 3 parts to this program. One is an innovation learning network, where Mass Cultural Council provided learning for arts organizations over a course of 5 months. We're trying to scale this and take this learning virtual so that it can be asynchronous and live online, so that as staff change at organizations, that learning can continue. Once you went through the learning and you proved that you were doing things that helped to make your organizations more accessible, you became UP designated, Universal Participation designated, and that opened you up to another fund that we provided called the Innovation Fund. We have more than 90 organizations that have received UP designations. We're going to be deepening the designation and also expanding the learning. So we hope that every organization in Massachusetts can become UP designated. Next slide, please. This is a new idea we're working on. We've done some research around really thinking of innovative ways, social entrepreneurship ways of getting arts and culture infused into other sectors, but also finding new mechanisms for new patronage and more resources for arts organizations. So the idea is simple. We want to encourage employers to add an arts benefit to their employee benefits packet. Many of us have worked for organizations that have a healthcare packet, tuition packet, a transportation packet. So we want them to add arts to that so that all of their employees can engage in arts and culture. One of the ways you can do this if you work for a major organization is you can expand what you mean by wellness. Many organizations are funding gym memberships and yoga classes. If you expand wellness to include arts and culture, this may be a no-cost addition to your benefits packet. You can also just add a separate arts reimbursement plan. Say you want to offer all of your employees $50 a month to spend on arts and culture. They spend that money, they submit their receipts, and they get reimbursed on a monthly basis. There's lots of information that's been out there for many years. Daniel Pink and Richard Florida have talked about creativity being a major skill set. Forbes has just released a survey from the World Economic Forum's Future of Jobs survey that has listed creative thinking as the top priority needed by the workforce. We have a lot of problems to solve in our world, and we need creative thinkers. And this also prioritizes alternative solutions for employee wellness. So we're pushing it out there. We're just providing businesses across the state with this information. Hopefully HR professionals and CEOs will just add this to their employee benefits packet. Next slide. This is more information from Mass Cultural Council. If you want to reach out, we can send you more information on the Card to Culture program, the Arts Benefit for Employers, the UP initiative, and then this wonderful arts prescription program. The other thing I was going to say about arts prescription is that this is in the beginning phase of it. I think this will be part of the zeitgeist. And if you remember, 20, 30 years ago, we newly discovered that physical fitness can help your health. It was a new concept for us. And so now when you go to your doctor, they'll say to you, tell me about your sleeping habits, tell me about your eating habits, tell me about your exercise habits. What I'm hoping in 5, 10, 15 years is they'll say, tell me about your arts engagement, because we know that arts and culture can help people feel better. But it really is going to require the arts sector to step up and get into rooms with healthcare providers and sell this product to them, sell your product as a healer, as medicine, so that they can start adding it as part of their healthcare benefits. Thank you so much.
Thank you so much for that presentation, Michael. That was excellent. Really love the work that you all are doing with Mass Cultural Council and your collaborations with healthcare providers and arts and culture organizations. And we're definitely looking forward to learning more about the outcomes that with your recent partnership with Art Pharmacy. As we see, you're going to see Art Pharmacy a lot. NJPAC is working with Art Pharmacy. Mass Cultural Council is, we recently over here at Save for the Arts are having conversations, and Chris Appleton was also one of our speakers at our summit this year for a 2024 Arts and Culture Summit. So thank you for just sharing that wealth of information and revelation of how we can really bring the arts into healthcare. Now I'd like to introduce our final speaker for today, Dr. Elizabeth Markle. Dr. Markle is a licensed psychologist, speaker, writer, researcher, and professor of community mental health at Oakland Institute of Integral Studies. She is the co-founder of Open Source Wellness, an Oakland-based nonprofit offering experiential behavioral health and wellness via a community as medicine approach in collaboration with healthcare providers and insurers. Dr. Markle is a thought leader in the field of health and wellness and has been sought after as a consultant for her unique insights and expertise in clinic community integration, innovative approaches to mental health and group facilitation. Thank you, Dr. Markle, for joining us today.
Thank you so much. Wonderful to be here. It's funny, I've been listening to this and realizing that, I don't come from the arts world exactly. I come from the healthcare world, and hopefully I can bring another story and perspective, and I think I'll speak briefly so that we can have some time for conversation and questions. But in brief, I'm a psychologist and professor of community mental health by training, and I worked for a long time in integrated primary care behavioral health, which is a fancy way of saying that I was the therapist or psychologist that supported both providers and patients with the behavioral aspects of their care. And I worked in giant healthcare settings like the VA and tiny, what we call federally qualified health centers. These tend to be small, although not necessarily, they tend to be smaller clinics that get federal funding to serve patients regardless of their insurance status or their capacity to pay privately. And so learning about how these FQHCs or federally qualified health centers work was really key to me later on as a co-founder and executive director, to understanding how to integrate with them and be in partnership and leverage sort of unique funding mechanisms to make this work accessible. Because in resource abundant landscapes, it's easy to find care, and in these really underserved and resource scarce environments, we have to be really crafty about how we fund these programs. So during my time working in healthcare, I got really interested in what I now call behavioral prescriptions. At the beginning, I just called them things that doctors tell their patients that they should do. And I started keeping track of them because I had the fortune of sitting in on and observing and providing coaching during a lot of healthcare appointments. And here's what I found. Regardless of who the patient is, what their diagnosis is, whether struggling with hypertension or depression or diabetes or something else, and regardless of who the provider is, whether it's primary care or specialty care or mental health, most of our patients are getting one or more of 4 big behavioral prescriptions. And if I could crowdsource this somehow, I know you all would guess them. They are, in brief, number 1, you should exercise more. Number 2, you need to eat better. Number 3, reduce your stress, like no problem, right? And number 4, get some social support, or you need some meaningful connection in your life. Now, as far as I'm concerned, these are fundamentally not bad advice, right? We've all probably heard these or told ourselves things like this. The problem is that they're delivered verbally at the end of a really busy, rushed appointment, followed by something that sounds like, okay, then good luck with that. Take care now. I'll see you in 6 months. And that's kind of the end of the conversation. And I think there are so many problems with this. You know, obviously we have a delivery system problem because this is a prescription to nowhere, right? There's no CVS you could walk into and get help with this kind of prescription. And second, we have an equity problem because if you have the privilege and the capital to start shopping at Whole Foods or hire yourself a private health coach, you have a shot at this. And if you don't, it really is a prescription to nowhere. So all of that is a setup. In 2016, my co-founder and I, Dr. Ben Emmert Aronson and I, co-founded Open Source Wellness. Next slide, please. Thank you. You're so on it. Open Source Wellness, we're an Oakland-based 501c3 nonprofit with a mission to generate what we call community as medicine by partnering with communities and healthcare to generate joyful, trauma-informed, and culturally relevant programs for health, well-being, and human connection. And since we've been doing this since 2016, we have gone through a lot of iteration and innovation and learning and successes and failures. And right now, there are a couple things I can say about how this model looks and how it works. Next slide. So community as medicine, it's an experiential, equity-centered, trauma-informed, and joyful approach to group health and wellness coaching. And those 4 icons there represent our universal prescription, which we abbreviate move, nourish, connect, and be. So physical activity, healthy food, social connection, and stress reduction. And if we just move quickly through the next 4 slides, you'll get a sense of what that looks like. So here are groups doing fun, playful physical activity that's just as much about laughter and play as it is about sweat. Next slide, we're practicing dogma-free stress reduction. That's just like culturally accessible and simple. Next slide, we are learning about and preparing and eating tasty plant-forward food together in community. And perhaps most importantly, we're connecting with each other in authentic and powerful ways. And so when I say health and wellness coaching, I do mean group health coaching, where a group sits together around a table or in a Zoom breakout room and speaks about their goals and their challenges. But I also mean groups of people coming together to experientially practice these drivers of health and well-being: move, nourish, connect, and be. Next slide, please. So if you see a community as medicine group happening, it looks like play, joy, belonging, vitality, vulnerability, connection with self and others, all of those ingredients that engagement with the arts is designed to generate in individuals and in communities. Couple things to say about this work. I said that it's experiential, so there's no lecture, there's no class, there's no telling people what they should do. There's just bringing people together and doing it in community. Our work is what we call transdiagnostic. So we don't have groups for people with depression and groups for people with diabetes. We have groups for human beings who, by their nature, have strengths and challenges with their health and well-being, just like the rest of us. Our model and our coach training and our implementation is trauma-informed, and we could talk a whole lot about what that means. And it's culturally relevant, which means that every aspect of this model gets adapted to the population at hand. So when we are in a Latinx serving health center, not only is the program conducted in Spanish, but the food is different and the music is different and the movement is different. All of this gets kind of titrated or tailored to what's resonant or relevant to the population that we're working with. Next slide, please. So we have partnered with a lot of different kinds of organizations to deliver this work, and there are a couple logos here. I'll move quickly because the good news is that since 2016, we've been gathering outcomes data to really measure the impact of this work. And I hate to say it, but healthcare is one of those fields where they're interested in the good work that you do, and they really want to see the outcomes data. And so no matter what kind of context we've been doing this work in, we're getting similar outcomes. And I'll just move through those really quickly. So next slide. We're seeing significant increases in participants' daily intake of fruits and vegetables and weekly minutes of physical activity. For patients who are struggling with mental health challenges, we're seeing substantial drops in depression, and that's measured by the PHQ-9, which is kind of the industry standard. The GAD-7 is measuring anxiety, and the UCLA 3M loneliness scale measuring loneliness. This is a sample of about 200 and some participants. For our patients who have hypertension, we're seeing substantial drops in blood pressure. And then the data that really gets the attention of potential payer partners, insurers, this is drops in emergency department visits and unplanned hospitalizations. So I could talk much more about what we do. I think it's exciting, but at some point in the conversation, somebody's thinking like, that's all well and good, but how do we pay for it? And so this has been, the challenge of my last 8 years. And I don't feel like we have the one true way. I feel like we have been opportunistic and flexible and creative about bringing together braided funding sources. And so I'll talk through a couple of the ones that we've used internally, and then I'll share about what some of our implementation partners are finding to be effective. So speaking in very broad strokes, if you're interfacing with healthcare, there are value-based models and fee-for-service models. And in value-based models, the potential payer or partner is looking to essentially whether you can generate outcomes that will reduce costs for them down the road. And so if we look at this emergency department visit slide, next please. This is a substantial cost savings. Emergency department visits and hospitalizations are very, very costly to payers. And so if you can track and demonstrate in partnership with a clinical delivery system or a payer that you can impact this, this gets attention. Another way that we have found to leverage sort of a complex value-based partnership is by bringing together multiple stakeholders. And this takes time to build, but essentially in Alameda County, which is our home base where our most of our direct service footprint lives, we are in partnership with the payer. There's one managed Medi-Cal insurer, that's Alameda Alliance for Health, and a government organization called it's now just called Recipe for Health, and a funding initiative. So CAL-AIM is an acronym, I want to make sure I get this right, that stands for Advancing Innovation in Medi-Cal, that allows, it uses Medicaid Section 1115 waivers that allow Centers for Medicare and Medicaid Services to approve innovative projects that promote the well-being of people by routing what would be clinical downstream healthcare funding upstream, as they say, to pay for community-based and non-clinical services. And so these funding initiatives have gone towards supportive housing. They've gone to food as medicine programs and many others. But Recipe for Health is an example of a new program that leverages payer dollars towards food as medicine. And this is where patients or participants who are identified as having chronic conditions or food insecurity receive doorstep delivery of regeneratively grown produce. And the clinical delivery system, in this case, Alameda Health System and other related low-income clinics, are prescribing this to patients. And the way that we, Open Source Wellness and the Community as Medicine model are involved is that we are providing our Community as Medicine model, the health and wellness coaching, as an adjunct to the food. And as such, it's being covered by healthcare dollars. And so this is sort of one of those sort of, creative ways that even while the healthcare system is not quite yet ready to sign on and say, yes, we're going to pay for Community as Medicine directly, period, when we pair it with an existing innovative development, we can kind of bundle it together and then get it funded. So happy to say more about that. There's another strategy that we've been using since 2017, which is around group medical visits. So to just sort of high level how this works, a clinical primary care provider prescribes a patient participation in Open Source Wellness or Community as Medicine. And because we have data use agreements and we're HIPAA compliant and sort of engaged with that clinical provider, we get that patient's name and phone number. And our team of health coaches reaches out, engages them by text and phone, has a conversation about what they're struggling with, what would make a difference for them, and then enrolls them in a weekly experiential Community as Medicine group. And that group can happen in person at the clinic, or it can happen virtually. But there's a clinical provider, usually primary care, that is a staff member of the clinic who joins the group and pulls patients aside for short individual medical visits. And they are then able to bill for those short individual medical visits. And there's some of the billing codes that are used here. And then Open Source Wellness coaches are still running the program. They're providing phone and text support, and then we're generating outcomes data. And the reason this is so key is that with this group medical visit model, Community as Medicine or Open Source Wellness is able to help the clinic generate a lot more revenue than it would without us. So if we look at the next slide, this gets a little numbers wonky, but in brief, in a between 2 and 4 hour chunk of time, we're able to help that provider briefly see an average of 16.2 patients. Without us, they'd be seeing 7.5 patients. That's an extra 8.7 patients per week on average, at roughly $250 a visit. Now that varies by clinic, but that's, a rough estimate here in California. We're helping that clinic generate a ton of revenue. And then we're contracting with them at approximately $80,000 a year, helping them clear additional revenue. And so this has really been a part of our pathway into partnership with federally qualified health centers, is saying, we want to support your patients and we're going to help you survive. Okay, Next slide, please. So in 2023, we as an organization had sort of a mission vision summit. And with our participants and our board, we said, are we going to try to grow open source wellness to be a massive nonprofit with staff on the ground in every city? Or are we going to train and license local organizations who have local resources and cultural relevancy and infrastructure to deliver this model? And we chose that option. And so since then, we have been embarking on this project of supporting other organizations to deliver community as medicine. Next slide. And part of what we've learned is that there are all these different pieces that have to come together in order for this to work. So having great health coaches is one thing, but having the financial sustainability pieces and the analytics and the referral partners, all of that needs to come together. And we've chosen YMCAs as one example of an organization that's really primed and ready to deliver this kind of model. So we've been working with the San Diego Y, the Denver Y, and the Minneapolis St. Paul, it's called Y of the North, YMCA, to deliver this program at scale. And really our vision is that it should not be okay to say, exercise more, eat better, reduce your stress, good luck with that, off you go, that there need to be, you know, both local and nationally scaled behavioral pharmacies, if you will, that help deliver on those prescriptions. Last slide, I will say, one of the ways to help make arts and other interventions that generate health outcomes and community connection and goodness is to pair it with an existing service that's valued and funded by healthcare. So one way we're seeing this happen is with community health workers, and that's another whole webinar, but there are payment mechanisms now in many states to fund and directly reimburse the work of community health workers. And right behind that is coming this wave around health and wellness coaches. There's now a national board that certifies and regulates the field of health and wellness coaching. And we have embarked for the last 3 years now on training health and wellness coaches. And so I think there's a lot of potential for arts-based practitioners and programs that may not be psychotherapists or other healthcare professionals to get this kind of credential relatively rapidly and integrate the two in a way that would generate open doors in the funding landscape. So next slide, I think I will pause there. Please don't hesitate to be in touch, and looking forward to a conversation here.
Thank you so much for your presentation, Dr. Markle. We're so glad to hear about the impact that open source wellness is having on Californians right here in our state. And I appreciate you sharing some of the value-based care models and fee-for-service models, in addition to the pre and post test data, because we all know funders definitely would like that to be able to do more things and more programs. A big thank you to all of our speakers for sharing your exceptional presentations. You know, you can see the chat box is filled with support and love and wonderful comments. So please make sure you scroll through that when you get a moment. And I think just kind of wrapping up all our presentations, it seems like it's going to take a big village, right, for this to kind of become a universal framework for not only California, but the whole entire country. So we're going to need our performing artists, our educators, our healthcare workers, clinical staff, admins, right, advocates, and really being able to tap into the communities to meeting their needs and where they are at. So we are slowly but surely working our way there, and it's very inspiring to see all three of your organizations doing this work. You made it sound very easy, and we know it's very complicated, so kudos to all of your team and the hard work that you all do. So now we are going to move into our Q&A segment. So as a reminder for the audience, if you have any questions for our speakers, please write them in the Q&A box by clicking Q&A at the bottom of your Zoom window. You can also preface it with the name of the speaker. That will kind of help us delegate which questions go to who. So again, some questions will be answered live, and we've got plenty of time right now so that our speakers can answer verbally. And then they'll also be able to answer some questions by typing it in the Q&A chat box too. So I will go ahead and take a moment and multi-spotlight everyone, all the speakers on screen. And to start off, I'll give it a moment for y'all to think about this response for the speakers, and I'll hand it over to Nafesha for any quick comments. So the question that we will kick off with for the speakers before we jump into the questions from the audience is, what can listeners do with this information shared today to advocate for arts and health in their communities? And I'll leave that for the speakers. I'll hand over to Nafesha briefly for any words of encouragement and support, and then I'll make sure everyone gets on spotlight. Thank you.
Yeah, before I go in at all, I think leaving space for you all, the panelists, to answer that question will be good, and then we can go on to some of the questions in the Q&A.
Awesome. Let's go ahead. Again, I'll repeat the question for the speaker is, what can listeners do with this information shared today to advocate for arts and health in their communities? Let's go ahead and start off with Ali.
In the hot seat. I don't know about everyone else. I was really inspired by, the work that Michael and Elizabeth shared. And so thinking about how any of these threads might be applicable to you and your community and your position. I know I took a screen grab of Michael's slide of, adding arts to benefits packages, right? I'll be sharing that with our HR people and organization folks, because we've been talking about, having ArtsRx as a program available for our staff, right? Our staff is our community. They need access to arts and culture too. And so that's my first thought, is just thinking about how any of these threads might be applicable to like any of your kind of immediate networks. And then what I kind of saw in the chat too is this idea of really finding your people in collaboration, right? Like this work doesn't happen in silos. This work is inherently cross-sectional and collaborative. And what California for the Arts is doing a great job of, like through these type of series, are really, connecting people with other people who are kind of thinking along these lines. I once was at a conference where everyone was like, look for the unicorns that, think about arts and health. And I was like, well, we're in an auditorium full of these uniforms, or unicorns. We're not as unique as you would once think, right? Like we are all really multifaceted and have these multifaceted interests, and we need that kind of holistic view of well-being, as Liz was talking about. So that's my initial thoughts.
Thank you, Ali. We'll go ahead and have Michael respond to that question.
No, I think that the information that Dr. Markle shared with the data and how payers are looking to figure out how to fund this and what information they need is all important. And what we decided was that, yeah, each arts organization can build a relationship with a healthcare provider and a payer on their own, but we're not necessarily equipped to gather the kind of information and data that they would need to maintain this program. So we decided to hire a third-party vendor to help us with that at Art Pharmacy, because they're equipped to it. They're professionals in the healthcare service industry. It's better for people that know that to do that. I also think that we had a big pivot I guess midway through this process, because we were really, for the most part, focusing on the arts organizations. And as I said earlier, this is a healthcare issue. And so this fall, we're going to be having a big convening with the healthcare sector to talk about this, us as medicine. And I will say, running a state agency, I'm in rooms with lots of arts organizations, and sometimes it's hard to get us to step out of the rooms that we're comfortable in and go into rooms where we don't know those people. But that's essential to the growth of this. I mean, you're seeing a bunch of models. There are dozens more happening across the country. This thing can become part of the zeitgeist, but it really is going to require us to, this is probably a terse way to say it, but to change our behavior, to say that, hey, we are a solution, and so you need to start paying us, just like you pay medicine for prescriptions, pay us for prescriptions. So it's a mindset shift. It's a behavior shift. It's convening healthcare people to say, we're here to support you. Art can be used for aesthetic purposes, but it can also be used for practical purposes. And then working with people that can do the kind of data tracking that the payers and the healthcare providers need to make this grow.
Awesome. Thank you, Michael, for your insight. And Dr. Markle.
Yeah, so well said. I wish an art pharmacy would have been around when we had started. That would have probably accelerated things. What I can share is about how we did it, which I'm not convinced is the easy way or the fast way. We tried to create internal champions within healthcare. We started running our program every single week and had devoted participants. And then once a month, we had healthcare professionals night. And we invited every MD in the area that we could get a hold of. And we dropped off flyers and we encouraged them to come. And a lot of them came because they were present to the failures and their own complicity in the failures of healthcare. And many of them just said, this is so cool, and I don't know how to do what you're doing. But a few of them said, oh, we got to bring this to my clinic. And then they helped us sort of ease the way and navigate the intricacies of healthcare that without that internal champion, we would have been sort of another cold call. So I think building those relationships and those champion roles is key. And then I would say build partnerships with other organizations that are adjacent to clinical healthcare. So, food as medicine was one of those adjacencies for us that's gaining entree into healthcare, and we could kind of tack on. I will say there are research organizations, right? If you have a research university anywhere near you, building a relationship with those faculty can give you access to master's students and doctoral students who need to do these kinds of evaluations for their academic studies. And so if you can get a skilled and devoted student to kind of sign on with you and help you build the evidence base for your specific intervention, you will be further along than when you approach the healthcare sector.
Thank you, Dr. Markle. And Afesha.
Yeah, thank you for each of you answering that question. I'm gonna hop to the Q&A and to kind of riff off of what Dr. Markle was just saying. There's a question about open source wellness in particular, but I think that any of the panelists would be able to answer this. Eliza asks, are there specific demographics that you find the funding options work best with the models you are using, specifically at open source wellness? But again, I think that this would be an answer for each of you. And they said, i.e. youth, elders, intergenerational.
Well, I'll say, we have from the beginning said we were going to be transdiagnostic. We were going to bring people together across diagnostic and demographic variables. So our groups are quite diverse, and our coaches work really hard to help people connect across those. Some of our partners, I think the San Diego YMCA, I think is going to be piloting a group for postpartum women specifically. And we've gotten a lot of inquiries over the years about whether we would do a youth-facing program. And while we've piloted it, it's not ready for prime time yet. And so I think there's a lot of work that could be done in looking specifically at the outcomes with different populations. And I know some of my colleagues here have done that work.
The only thing I would say is the Mass General Brigham United Healthcare Partnership is specifically for a specific medical condition. I think it's high blood pressure and diabetes. So they're working with that population. But in the beta testing that we did when we had the 2,000 prescriptions written, it was across demographics. What we loved about the beta testing is that the doctors got it. There was not a lot of work to convince them that this was a good tool. They also loved having something else that they can provide their patients that maybe weren't having a physical issue or even a mental issue that warranted prescribing medicine. And so they loved it. One of their doctors said they felt like they were prescribing Willy Wonka golden tickets. Another doctor said they felt like they were prescribing beauty into someone's life. The other thing I will say is in Massachusetts, 40% of our budget the state's budget, it goes to healthcare. And most of that money is going to sick care, not preventative care. So imagine if this tool grows, how much money it could save all of us that could be used for other kinds of needs. So that's why, again, I think you all are here on August 21st, 2024, where this thing is stepping across the line of becoming this historical, monumental thing. And so what we do now will determine what happens with this in the near future. So it's important that we step up and use our skills to convince those that make decisions to use us as a tool.
Alyson, did you want to share anything around that? If not, it's totally fine.
No, I just yeah, I think that Michael touched on a couple of things. And in the US we have a different model of healthcare, right, than other countries internationally. And really what Michael was saying earlier about kind of like who has the incentive, right, and who should be paying for this. And this is really a model of preventive care, and our insurance carriers have the financial incentive to provide for the preventive care, right? That's why they pay for, like, when you have insurance, that's why they pay for our annual screenings. That's why they pay for your annual checkup. And this is that kind of ongoing preventive care. And then I'll add that, a few of our referral sources do have like a social determinants of health screening tool that they're using more broadly to kind of assess their patients' more holistic needs. And this is kind of one more tool in their tool belt of things that they can connect people, resources that they can connect people to in our community.
It's very helpful. And Alyson, you mentioned something Michael mentioned when he was speaking about having the healthcare system paying for this and not necessarily philanthropic organizations. And I know a lot of people on the call, there's a diverse group of people. We have questions coming in around funding, grants, ways that individual artists can be connected. I see a question in the chat where Mark is asking, how can an individual artist go about approaching healthcare organizations? And right now we're talking on this very we're talking about businesses, organizations, healthcare systems, but what are some of the ways that maybe if there's an artist or there's an organization that wants this to become a part of their work, they can approach it and make some headway in their communities and maybe find some funding for that?
I mean, I'm not sure. I think there are different ways the arts can partner with healthcare. I mean, I went to facilities today and the walls were covered in art. And when you asked the patients about it, they felt more comfortable in that space. The hospital also funded residencies with artists, individual artists for their long-term patients. So I think there are many ways that the arts can participate in arts and healing, specifically with this model. And this is the beginning phase. I hope we can scale this. In the beta testing, we allow social workers and school counselors to also provide prescriptions. We've gone back a little bit to healthcare providers, but every fourth email in my inbox is now about arts and prescription. We've heard from Veterans Affairs, we've heard from housing authorities, we even heard from our state's gaming commission to use this to help mitigate gambling addictions. So I think, again, everyone's like, oh yeah, we hadn't thought about that. Now that it's out there, we can start using it. So I do think that at some point, just like we have private medical providers being able to prescribe, at some point, maybe this can work with the art sector. I don't know what that looks like yet, but since we're at the beginning phase of all this, let's dream big about how this can continue scaling.
Yeah, I think that's a really great insight. And I think too, as a field, we're excited about the prospect of this becoming mainstream, right? that people everywhere understanding that the arts can be used for health and well-being, and then going out into their communities and seeking those services, right? And so seeking those ceramics shops, or seeking arts providers or artists and arts facilitators. And that's actually the slide where we saw Chris from Art Pharmacy is on our advisory board for, is that education piece, right? So that all of the artists that are, saying, welcome to everyone who may have all of these social determinant of health needs, can provide these services in the context of safe and effective care, right? And have that kind of trauma-informed training, learn more about what public health is and how art and creativity can be used in service of public health and personal well-being. And so that is our goal in that kind of education piece, is to help build capacity for artists to be able to use their work and facilitate their work in a safe and effective way. And then for organizations to also train their artists through these series.
Excellent. Thank you for those answers. I just want to read Alexandra's thought in the chat, and I think it's a really good one. She said, I think about how mindfulness and meditation is now mainstream and covered by many health plans. Arts can be next. And I think it's a really good point that she's making there. And it also goes along with us starting with almost like a mindfulness movement exercise at the very beginning. It is hand in hand. And when we talk about wellness, it's so connected. Dr. Markle, there's a question for you in the chat, and I'll just read that also. This is from Alice. She said, I noted I might be pronouncing that wrong. Genentech.
Yeah.
I'd just know about the relationship, the collaborative partnership that you have, and if they have supported financially as a grant funder.
Yeah, thank you. And somebody else asked about, how do you get corporate funders? So candidly, we have not been wildly effective in getting sort of corporate social responsibility or grant funding. We haven't put a lot of attention on it, and it's probably time that we do. However, we do a lot of speaking and facilitation for corporate audiences that generates revenue that supports our community-facing programs. So with Genentech, they have well-funded internal all staff or all team or offsite or retreat kinds of things for their constituents. And we lead a session called Community as Medicine. That's a really sort of impactful journey that invites people to really reflect on their own well-being and connect with each other. It's playful, it's joyful, it's tender, all of that. And we do this quite a bit traveling around the country. And this has been a powerful entree into giving senior leadership individuals an experience of this work, which then can lead to a conversation about funding and supporting this. So my recommendation would be for all those arts organizations out there, if you can develop a corporate facing workshop, retreat offering that can sort of get you in the front door and in conversation with their leadership, that has been not only financially supportive to our organization, but also helpful in navigating partnerships.
Thank you. A few more questions before we close out. There was a question that just came in the chat by Sarah. Are you familiar with any U.S. museums that have social prescribing programs? I thought that was an interesting question there. Does anyone know any museums that have that?
I mean, through the Art Pharmacy, we have 400 organizations in the database, over 400 now, and I don't know how many are museums, but none specifically that I know of doing social prescribing.
Yeah, I think.
Sorry, I was going to also mention, I know some people were excited about the employee benefit program. We're going to be talking to employee assistance programs to see if arts can be added to that, and also workers' comp programs to see if arts can be used as a rehabilitation tool. So just thinking really social entrepreneurially, that's not a word, but I just made it up. Thinking innovatively about how we can get infused into existing systems. Because I think all these things, prescriptions, employee benefits, all these things can help expand our patron base and come up with diversified revenue streams that aren't just relying on sales and and grants.
Yeah, and I would just say any museum that you are curious about, get in contact with their access team or their education teams, because usually they're involved in kind of that community engagement piece and like creating more access into the museum to view the collection. And those are often the folks that are kind of starting to create programs like this or partnering with organizations like us to be a part of a larger social prescribing program.
Excellent. All right, one more thought and question. And they kind of go hand in hand, so I'm going to try to answer two people's thoughts. Jason in the chat mentioned how many cultural organizations, and we started off, and Michael, you reiterated it, which I appreciated, that this has been going on. Artists have been working as cultural practice and healers in their different communities for many, many years now. And more recently, the conversation has picked up. We see it taking place in places like Europe, in New Jersey, in Massachusetts, now California. A lot of the work that Dr. Markle, you've been doing for many years. And the conversation is now, you're starting to see it a lot more. So to go to the chat, Mercedes had a question about resources. And I think a part of what we're seeing is that data has been collected. More information it's more proof that the arts can do what we kind of innately know it can do. And so do you have maybe some of your favorite resources that you go to? In the chat, Mercedes mentioned Your Brain on Art, which is a book that our organization mentions to a lot of people. But maybe you have some additional resources that maybe were mentioned in the slide, or maybe you haven't mentioned in your slides, but you want to bring to the forefront.
I would say the University of Florida Epi Arts Lab is a great one in terms of resources. Your Brain on Art, the National Organization for Arts and Health, Social Prescribing USA. Those are just a few to get started. I'll let folks.
Yeah, we worked with the University of Florida and Dr. Tasha Golden to create a field guide. So you can find that on our website. And to reiterate, I forget the name of the person who was talking about the arts being a healer forever. My next area of tackle is STEM to STEAM. We all know the benefits of education from the benefits of arts on education, but the STEM lobbyists left us in the dust. And so here's another place where we're thinking innovatively about how to get STEAM in our legislative thinking, so that all has the kind of infrastructure that STEM has. So next year we'll come back and talk about that.
Yeah, we need to get some economists on our research team.
Yep.
Agreed. I don't think I have resources to add in the arts realm, but I will say, the work of standing for a possibility that does not yet exist, but by your word will exist in the future, that's a skill. And there are groups that help you build those skills of speaking about something in a way that everybody who's listening or the person that you are working with is moved and inspired to be in action in support of your vision. And so if it sounds exhausting or daunting or intimidating, like that is the key skill. It's being able to speak to somebody such that they are like, how can I help make this a reality? So there are lots of resources that help with that.
Jen, before we wrap up, I wanted to make sure that if you had anything you wanted to add before we go into our conclusion. I know we're getting close to 1:30.
No, I'm good. I'm just answering some questions in the Q&A. So for those of you, you can also look at the answered column in the Q&A box. If you would like to see, there might be a response to a question that you also shared with another participant too. Thank you.
Absolutely. Well, thank you all to each of our panelists, Alyson, Michael, Elizabeth, Dr. Markle. Thank you for joining us today, taking the time out. It's been very inspiring to learn from all of your presentations. And I definitely took in a lot today as we work on our arts and health initiatives here in California. Thank you for your innovative and creative approaches and navigating through some of the complex funding and programmatic systems. We would like to thank each of you and everyone for tuning in. This webinar series, again, is sponsored by the Music Man Foundation, and we are grateful for their support of our Arts and Health initiative. One more slide there, and we're going to check out our next upcoming webinar, which will take place on September 4th. We've got 2 more for our series. This is a sneak peek of our next webinar. Make sure that you register. The link will be in the chat. And we'll have the webinars on our website. You'll be able to watch the recordings on our YouTube playlist. And also, please take a moment to fill out our post-webinar survey. This really helps us to be able to give some feedback, to receive the feedback that we need to create really meaningful programs and further this initiative. We would like to get to know you and your feedback. Again, it'll help us to develop our future programs. And it will also be shared in a follow-up email with resources from today. So some of the resources that were mentioned, we'll make sure go into that follow-up email. And again, thank you all for joining us today. And until next time, let's continue to build a more creative California.
Thank you, everyone.